Welcome to Plastic Surgery Secrets Talk, the podcast where we go behind the scenes of everything interesting in plastic surgery and the aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. O'Neill from the Spiegel Center just outside of Boston. We are excited for season 3 to continue.
So the question today, have you ever had a patient change their mind last minute, like on the operating table or in the treatment chair?
In my treatment chairs, very often.
Happens all the time, right?
Just when I'm done injecting with the fillers. Like, we're done with the filler.
That's the best possible
I'm
time
ready
to
to
ask for
throw it out. I'm not ready to throw it out. I threw it out, and then they go, oh, by the way, if you have any left, I just told you I was done. I just want a little bit on the lips. But really, that was my number one primary concern, was the lip.
Oh, I just didn't mention it to you.
temples,
I just thought of it,
everything.
yeah.
I just thought of it. I forgot. I'm so sorry, but I really need you to do my lips. Or something crazy like that.
No.
But I was like, but we talked about one syringe, and you didn't talk about the lips. Or sometimes they talked about the lips, but I forgot all about it because we talked about so much else.
Oh, man.
Yeah, they
Just
go,
saying.
well, I want to do my lips, but I also want to do my nasolabial folds. I want to do my marinus. I want to do my
yeah.
temples. I only have one syringe. And
I
you
have
go,
one syringe, and then I'm like, oh, it's done. Ooh, okay.
yeah, that's right. Yeah, that definitely does happen. I've had that happen a couple of times where usually someone comes to the operating room and they do it the other way. They're like, while you're in there fixing my nose, do you mind just doing my cheeks too?
You know, the most common one I get is the little skin lesions, like moles and stuff. It's like, oh,
really?
do you mind? Yeah, I know you're doing my face with my brow lifter. Do you mind doing, I've got like 20 moles scattered around my body. You're going to have to flip me over and do the ones on my back. And this is all no charge, right? Because it's just,
even if they were 5 minutes each, that's 100 minutes more.
Well, that's
than
what
an hour and
I
a
try to
half.
explain. I'm like, oh, you're adding on. Okay. Like we're
Yeah.
Could you just do 2 hours of additional little scar revision for me?
And meanwhile, you have your plan, and you got to stick to the minutes, like, because there are like 5 nurses in the room, a surgical tech with you, so many things, and everything. It's like this is like where people don't get it.
I use the analogy of a flight all the time. I'm like, we're running an airport here where we got flights coming and going, and everything's got to be like down to the minute for things to work properly, so that you're not delayed, the next patient's not delayed. And if you're adding on like all these little things here and there, especially if it's under anesthesia, it adds up. And then all the flights get delayed and everyone goes crazy and they're like, where's my baggage? What's going on here?
And I always say there are 2 professions that can never, ever miss. It's a surgeon and a pilot.
Yeah.
And unfortunately...
Always got to arrive at the right spot safely.
And unfortunately, we saw what happens when a pilot doesn't get it 100% right.
Yeah, it doesn't go well.
Yeah, it
That's
does
right.
not go well.
Yeah.
So
That's right, we always
you can't.
I like your analogy. That's like getting on a plane from here to Miami and so on. Could you mind just making a quick stop in Denver for me?
Stop in Fort Lauderdale and like pick up my friend on the way.
Yeah, before we go to Texas.
We're basically there already, so we just stop.
I think the Uber drivers get that sometimes too, which is why you can't do it. Taxis used to get that.
Yeah,
they don't mind
taxis
because the meter's running. With Uber, it's from A to B. It's very different.
The other one I've gotten, and I tell patients this, so when they're trying to we're talking about the plan, and usually we've already discussed it, and then they come in on the day of the procedure, and they start to say, well, do you think we can make the incision higher or shorter or this or that? And I basically summarize that as constraints, patient constraints. And I go, you're giving me so many constraints, it's actually almost going to become impossible to achieve the outcome that you want.
And stand on one foot.
And so, yes. And so I say basically don't sabotage your own surgery.
Results.
We've already talked about this. We've already planned it. And I've already mentally prepared to do the thing I'm going to do today. And when you start throwing in additional constraints on me, it's going to make it much harder to get the outcome that you want. So
That's so key.
If there's something you want to talk about it months beforehand, not in the pre-op waiting room or in the procedure chair.
I find it we're known to kind of produce very natural results. Like, our patients don't leave with chicks, out the wazoo.
They don't want to look like cartoon characters.
Yeah, no, they don't. But sometimes you get that one patient where they're like, I got to look as natural as possible, not a change. Well, then why did you come here? You don't want me to freeze your forehead. I got that, but I can't Botox your forehead and have full, complete movement like you do now.
That's a question
but have no lines. How?
When the patient goes, so am I going to look different after this? And I'm like, well, of course
That's
you're
the goal.
gonna. I hope you look different. I hope you're gonna look different. But what they really mean is, am I gonna look natural? Am I still gonna look like myself to my friends and family, or am I gonna look like unrecognizable?
You look different than you do today, but the way you did yesterday.
And there is so I understand what their question means, the intent of it. But again, they'll say, well, I don't want my brow to be too high or this or that. And I'm going, this is your first brow lift. I've done a dozen brow lifts
That's right.
in the last couple of weeks. And,
Yeah.
so just try not to interfere with your own surgical process too much, because the more you try to get in the pilot's, like in that co-pilot seat, and you're grabbing the controllers while I'm doing my thing, like that's how you crash a plane.
That's a very good point about don't try to control the process. It's much better if someone comes in and tells us what they want the outcome to be
Yes.
than to tell us how to get there.
Yes.
Right? Like Uber drivers, it used to be that you'd get into a taxi and you'd say, take me to the airport, but I want you to take Sturo Drive and not take Memorial Drive or something. That's the roads here in Boston. Or if you're in New York, you'd say, I want you to take the LIX instead of this. And the taxi drivers didn't care because the worse directions you gave them, the more they got paid.
Yeah, they run up the meter.
Yeah, they
or
loved
whatever.
it. But Uber drivers don't like that. They're getting paid to take you to the right spot. Their app tells them how to go. And if you say, take this road or that, they up your fee because they know you've just messed them up.
Yeah.
Now, we don't do that kind of fee stuff. But what you want is an outcome. And do you really need to know what stitch I use, whether it's, blue or purple? And do you really need to know if I use, a silver-colored instrument or a gold-colored instrument? These things, you read about it on the internet because someone will say, gold-colored instruments work better than silver-colored instruments.
They do.
Yeah, the people will write this
We
kind
only
of
use gold
Yeah.
here.
except for the platinum ones.
No, but I
Solid
often, with fillers, they do that all the time. Patients always I want to know what fillers. So I get it. So sometimes I say to him, listen, we're working in your tear troughs, or we're doing your nose, or we're doing your lips. I'm going to be using hyaluronic acid filler, and that's it.
I think
we're
that's
not going to
all
get
that's-
into brand
yeah.
names. We're not going to
Bitchy
get
prime.
into
Yeah.
I'm gonna
Trust
say
that we
to
know
you,
how to get you the result. That's
Right.
why people come.
That's why you came here. You did, and then sometimes I have to say to them, you know what? You're a smart person. You did a lot of research to come here, because we're certainly not a bargain shop. That's for sure. So you did a lot of research to come to me, and you knew what you were doing. So trust that you are going to get the best results possible, because I want to sleep well at night, and I want to make sure you're really happy. And for me to get another patient is for you to write a really good review, and you're going to only write it if I get you a really good
That's
result.
right.
Yeah.
So trust in
You
the
came
process.
because of good outcomes and other people's happiness. And speaking of sleeping at night, Dr. Tower, what's the funniest or weirdest thing someone has said to you while waking up from anesthesia? That's my next prompt.
Oh man, I feel like we've had a lot of so many. I call them Dave after dentist moments. For anyone who remembers the viral video of like the kid waking up from anesthesia and they're talking crazy talk. Usually the nurses relay it to me afterward, but the ones that I remember are actually the people who wake up really violent or combative, and it tends to be the men. It's all men who are in their like 20s, and I don't know why. It's like it's more often happens in the
we not
hospital.
50-year-old women who
than here.
Yeah, I was going to say my experience is different with violence.
It's like it's the young guys. They wake up and like they're just totally disoriented, and their instinct is to like push people away, and
That's so interesting.
they get all confused. I haven't had one of those in a long time. I don't think I've had one since starting to work here. We've got good feng
anesthesia
shui
team.
here and everything. Yeah, but those are the ones that really stick out in my
Yeah,
mind.
those are at the hospital. I agree.
Yes.
Here, people tend to wake up very smoothly.
Yeah.
And in fact,
It's
what's
because I
interesting...
wake them up to Enya.
Oh, that's what...
Yeah,
I
I've got
actually
the
heard
music
about
playing.
that
Yes,
today.
yes.
Or yesterday, that you listened to Enya. in
Yeah,
the
that's
operating
a
room.
new thing that I've been doing, and it's worked. I got 100% success rate on no punches thrown to Enya.
I usually play whale songs, songs of the right whale. But the medication we use, propofol here, as a primary anesthetic and analgesic in the OR, it has an interesting side effect, as you know, where it's a little bit of a aphrodisiac. And it has an actual side effect that way. People say there's no such thing as an aphrodisiac. Well,
is that
propofol
why?
really is. And people wake up usually feeling deeply in love. And I have many times had people wake up and look at me and go, I love you, Dr. Spiegel.
No, are you serious?
Absolutely true. Yeah, she's not able to believe this because she doesn't wake up that way.
She's like, "Are you serious?
Why would anyone do that?"
Yeah.
But that's a common thing. They wake up.
No, the other way. I'm like, wait, what are we doing here?
Yeah. How did I get in this position?
Who are you giving this?
No,
What's this
absolutely.
medication?
People wake up feeling great.
Oh, that's true.
And the one time I had propofol, I remember waking up from the procedure and them saying, "You're waking up now." And I remember thinking, "No, don't wake me up.
That I did
Take off
not,
more
yeah.
things. Take out things.
Do
More
whatever you
surgery.
want.
This is great.
Yeah.
I love surgery. I really do. This is the best thing."
Well, sometimes when
surgery,
you've got
please.
kids at home and you've got a lot of responsibilities and things to go
yeah.
back to at home, you're like, oh, but I'm in my space.
Safe
safe
space.
This is the best sleep I've
here.
gotten in months.
let me just stay here, you know?
And I occasionally get people, and this is a regular occurrence, maybe once every 2 months or so, where they wake up and some of the anesthesia person says, "You're done now." And the person goes, "Am I so hot now? Am I just
Oh, yeah.
so hot already?"
Yeah.
And we're like,
You will.
well, in a swollen kind of way. You will be very soon.
Good. Yeah. So guys, I'm gonna bring us talk about glowing and kind of like feeling aphrodisiac and all this
Feeling
stuff.
great.
We started, feeling great and rejuvenated and all that stuff. So we started this new program, the
Oh, the
Glow
VIP
program.
Glow.
Yeah, the VIP
Yeah.
Glow. Everyone is loving it. So many
Yes.
people are signing up. I have to tell you, I'm so excited about it.
So part of it's. Well, I don't want to cut you off.
No,
Part
no.
of it's hyperbaric oxygen, right?
Yeah, so it's hyperbaric oxygen. So talk about
part
like
of it.
aphrodisiac, feeling really, really
Feeling
good.
great.
Okay.
Like oxygen, pure
It's like
oxygen.
a whole wellness program.
I
Yeah.
have a hyperbaric oxygen patient. Just saw her today, actually. She'd had a facelift. She had some bruising over her cheekbone, so we gave her hyperbaric. Helped tremendously in the last week. But not just that. She told me, literally, just being in the chamber and the feeling that you get is almost like a little bit of a euphoria.
Yeah.
And she just like ride that for the next week afterward. And you know, I'm
It's a
like,
great
I'm
feeling.
I classify myself as a skeptic. I'm like, I need people to like tell me their feedback
I'm such a
before
skeptic.
I really.
I don't even believe you're a skeptic.
I don't believe the internet. Yeah, like I need like firsthand or secondhand, like someone's got to tell me that it worked. And I'm getting great reviews on the hyperbaric.
So I think that's part of it. Then you get the LED light.
Yes.
Which totally rejuvenation for your skin, and then the IPL. So it is like the best,
And more.
and you get a little bit fat freezing should you want it.
Yeah,
So
for
there are
areas.
4 elements.
I think
to
you also
this
they get
goal.
like access to us as consultations and get
There's
some of
all
our
kinds of
time.
benefits. It's just a whole wellness
whole wellness
commitment
thing.
for
It's
yourself.
like it's very holistic, and I'm super excited about it, and my patients are excited about it, and they're signing. And the ones who've already signed up are like loving it because it's really cost effective. Like they feel like they're getting
a bargain.
a bargain, which is so nice because let's face it,
Yeah,
we're not
you don't get that
bargaining.
many. You don't get many in life.
It's like a gym membership, but you don't have to go to the gym. You just get the spa features.
yeah, and you get the results.
You know,
so
interestingly, on the gym idea, hyperbaric oxygen has been shown in people who do not work out to create bodies that are as if they worked out.
Really?
So if you do work
bye,
out,
see ya.
if you do work out,
off
it's
to
even
that.
double. All right.
HBO.
And we've got a Mother's Day contest just around the corner. Is that
Yeah,
right?
in May. So I don't know all the details, but y'all
Watch our
better be,
social media
yeah,
for
y'all
the
better
sure
be
there's-
listening to it. Yeah.
All right.
And there you go. Yeah, because it's around the corner. What do you know? So on that note, I think we're done. I think let's leave some for next time.
next
So
month.
yes, for next month we'll really pump up. Mother's Day. We'll talk. Maybe next month we'll talk about like experiences that we've all heard from our Glow members.
Yeah, the
I
benefits.
think that'll be good. And if you happen to be a dentist, I'm giving a dental CE this month, so I'm excited about that. I already got my patient lined up for like a little lip
little
filler.
demo?
Yeah, a little demo there. So yeah, if you're a dentist or
Wanna
think
come
of
learn.
becoming a dentist, I don't know. No, if you're a dentist, get in touch with us and sign up for this CE.
Oh, we're
that's
always
coming up.
educating other medical professionals.
We sure are.
So
Yeah.
thank
There
you
you
for
go.
listening to Plastic Surgery Secrets Talk. If you like what you've heard and want to get in contact with us, you can call 617-566-3223. That's 617-566-FACE. Or email us at info@drspiegel.com. And you can also follow us on your favorite social media distraction at Dr. Spiegel.
right? And that's Spiegel, so always the I before the E.
That's correct.
See you next time.
Yep.